woman from Suriname came to the clinic because of a 6 months of evolution lambosacralgia. The pain started in the right paravertebral area, but in addition to spreading locally to the Qiao area, it also radiated to the back of the leg, Tai-yang, and the front of the foot, Yang-ming. Hers was a pain of indefinite limits, burning and throbbing, which did not have strictly mechanical characteristics, because although it worsened when standing and walking, it was also present when she was in bed. Dampness and heat worsened her pain, and when it burned a lot, it was often accompanied by a sensation of electric shocks. As acupuncturists can see, this pain did not follow the 8 rules of diagnosis. Apart from pain of mechanical origin, another possibility that a pain does not follow the 8 rules, but not the only one, is that it is the alteration of an extraordinary meridian. For the past year, Ria had also been suffering from hemicranial headaches every night, and almost always on the right side. The pain was intense, affected the eye area, and was relieved by local application of cold. From a physical standpoint, there was nothing relevant in her medical past history, and the scarce Jiangfu diagnosis did not explain her ailments either. Now let's go to the psychological context. Ria's husband had died 2 years earlier, and her daughter had just overcome a breast tumor. She said, "It's been hell." Obviously, the husband's death is an important factor. But why is it important here? Since she was 4 years old, Ria was not with her father. Her parents had separated, and her mother, who was a high-ranking government official, did not take care of her and his sister. They were looked after by her grandmother. Ria's grandmother died when she was 8 years old, which was very painful for her. When she turned 15, she was sent to the Netherlands, where she found herself without family and friends. Let's recap. No ties with her mother, loss of her grandmother at the age of 8, and at 15, totally uprooted again. Ria had a very good relationship with her husband, but he was a diplomat, and she explained to me that for the last 4 years of his life, they had been traveling all over the world, which such a lack of roots, found unpleasant. With the sudden death of her husband, the loss of attachment was painfully suffered. And finally, her daughter's cancer brought her to a critical point. I consider the alteration of a Qiao, obviously because of the confluence of the uprooting and the right hemicranial and lambosacral pains. But was it a yin Qiao or a yang Qiao? I considered yang Qiao because both the headaches and the lambosacral pain affected the right side. So, on the first visit, I tried bladder 62, which, in addition to be the key point, is the creative point of yang Qiao. I limited myself to needle only the right side. She came out of the session with heaviness in the leg, but no limp. She returned feeling outraged the following day, because the pain had worsened. Above all, the pain had increased in the popliteal fossa and on the sole of the foot. She could not bend her knee. The pain had become much worse, she complained. It is not uncommon for a symptom to worsen for the first 24-48 hours after a totally appropriate session. We have to wait and see what happens next. So I decided not to treat her that day, but to wait a bit longer. She came back after 2 days. The lambosciatica had subsided and she had practically no headache. I then chose another yang Qiao point, bladder 63, a single needle on the right side. 1 week later, she had no headaches and 35% of her right lambosacral sciatica remained, but only bothering her in bed. I repeated the bladder 63 puncture, but the pain increased again. So, the following week, I decided to repeat the bladder 62 stimulation on the right side. A week later, assessing the prominence of the symptom at 30%, she told me that only occasionally she'd felt a burning sensation. That day, I also refrained from treating her. When she came back after 15 days, she had no sacral pain nor headache. I then repeated bladder 62, a single needle on the right side, and asked her to come back and see me whenever the symptoms reappeared. That was 9 years ago. Jana, 30 years old, came to the clinic because of bilateral heel pain, which she had been complaining of for 1 year, but which had increased in the last month. For 3 years, this woman had also been complaining of cervical and sacral pain. She attributed her cervical pain to long hours of intensive computer work. The pain was laterocervical, accompanied by numbness in the arms. It often ended triggering a headache in the form of a feeling of pressure in the left frontal area, that is, Qiao. Regarding the sacral area, the sensation was of stiffness with numbness and weakness. This pain worsened when standing and walking. There was nothing remarkable on her pathological history. When I asked about her biography, she explained that she had always felt uprooted from her family. Her mother, who divorced her alcoholic husband, died when she was 2 years old, and her father was never present in her life either. As I was hesitating between a yin-Qiao emptiness or a yang-Qiao fullness, given the fact that her pulses were deep Chen, I started by needling kidney 6, but there was no change. The following week, I switched to bladder 62, which completely eliminated her pain for 3 months. Over the course of the following year, I repeated bladder 62 stimulation in 3 occasions whenever any of the pain reappeared, although with much less intensity. After 1 year, I discharged her and have not seen her since. I find it interesting to know that although all her pain symptoms were manifested on the yang-Qiao meridian, although this was not the case, they could also have been attributed to a yin-Qiao pathology. By this, I mean that in some occasions, I have found the deficiency of yin-Qiao mai to be the ultimate cause of what, at first sight, seemed to be a clear yang-Qiao mai excess symptomatology. I also find it beautiful to see how effective a single acupoint needling can be, as indeed proved to be in this clinical case.